Good morning, Senior Bride here. I'm going to discuss dementia this morning, and I want to give a trigger warning because I know for some of us, we've seen family members experience this, we have seen friends experience this, we may be experiencing it ourselves. So if this is a topic that causes you great stress, please just go to something else, turn this off. However, I do plan, that being said, I do plan to discuss both MCI or mild cognitive impairment and dementia, and the kinds of symptoms that you'll see, things that may mimic those issues but are not, and things you can do to reduce your risk. Okay, so first of all, what do we mean when we talk about cognitive decline or MCI, mild cognitive impairment, and dementia, and how are they similar and how do they differ? And what is the relationship? What are some of the main symptoms? What are some of the main kinds of dementia or forms of dementia? How can we tell if someone may be developing MCI or dementia? And what can we do to reduce our risk? I have added a link to the Mayo Clinic in the comments because they offer a very comprehensive discussion of these topics. It's a very good discussion. Okay, so first of all, terms like cognitive decline or mild cognitive impairment are used to refer to earlier symptoms of cognitive change, such as mild short-term memory loss. And these often occur before a diagnosis of dementia occurs, and it also may happen that you don't develop dementia. Like having MCI does not mean you're going to develop dementia. It just means there is some cognitive issue occurring. Now, it's important to note that when someone has MCI or cognitive decline, there are cognitive deficits, but they're still able to engage with the tasks of daily life. And they may continue to work and live and function quite independently. Structural changes in the brain will be noted at this time, and through autopsy studies, they found that these structural changes do exist. Now, it's important to notice that individuals at this point in their decline are often aware that things are changing, that they're having issues, and they may feel embarrassed and afraid, which means they may delay seeking help, and that is literally the worst thing you can do. If you're noticing changes, this is the time to get help. It may be, as I said, that you're not going to develop dementia, that it can be halted, or at least services can be put into place that will help you function and continue to go on, and it will slow the decline. So please seek help if you're noticing changes. Now, as I said, there's a number of symptoms of MCI, and those include short-term memory loss, things like forgetting appointments or activities. You may have difficulty following conversations and plots in books or visual media. You may have word-finding issues, so not able to think of what you want to say. And there's increased difficulty in finding your way around. So, for example, losing your way home from work, which you've maybe done for 30 years. There's also issues of judgment, so maybe not making the best choices. And this, of course, in turn can lead to psychological issues like depression and anxiety. And also loss of interest in activities that you may have formerly enjoyed, or feelings of anger and outbursts. As I said, there have been autopsy studies, and they found physical changes in the brains of MCI patients, including reduced size of the hippocampus, which is important for memory, increased fluid in the ventricles, reduced glucose, which is very important because glucose energizes us, clumps of beta amyloid proteins or plaques, and neurofibrillary tangles or of tau proteins, and you've heard the word tangles, and these are seen also in Alzheimer patients, but to a greater degree. They've also found Lewy bodies, but again, they're seen in a greater degree in, for example, Parkinson's patients and dementia patients with Lewy bodies, so dementia with Lewy bodies. As well, findings have sometimes include evidence of maybe small strokes or reduced blood flow. Now, an important factor in addition to older age is the ApoE4 gene, the ApoE4 gene, and this is a known genetic risk factor for Alzheimer's. However, all of these things are risk factors. They're not determinants, and the fact is we can do a lot to reduce our risk or even prevent dementia from occurring. Now, it's important to note that while MCI increases the risk of dementia, in that 10 to 15% of MCI patients will go on to develop dementia versus say 1 to 3% of the general population of seniors, it's clearly not a certainty because 85 to 90% of MCI patients don't go on to develop dementia in any given year. This is why it's so important to seek treatment and support, and why altering your habits at this stage can be so life-affirming and so very important. So what exactly do we mean when we talk about dementia? First of all, there are several types of dementia. They have many causes, and although they have some differences in symptoms, there's a kind of a group of symptoms that are very common among the dementias. So we've all heard that short-term memory loss is a common symptom. And although it is one of the earlier signs for many of the forms of dementia, it is not the only symptom. As well, difficulty with all levels of memory can result from many causes, not just dementia. And so don't assume if you're experiencing memory loss or you know someone who's experiencing memory loss that it's dementia. Things need to be checked out. In addition to the loss of memory and memory issues, there's communication skills, which are often impaired. Problems with spatial abilities, so finding your way home. Problem-solving deficits and difficulty completing complex tasks and over time even easier tasks. Problems with planning and organization. Difficulty with body coordination, so falling more easily. Feelings of confusion, changes in personality, mood, and behavior. Delusions and hallucinations. Paranoia and inappropriate behavior, including inappropriate sexual behavior. Symptoms will worsen as the disease progresses. Now, it's important to note that different types of dementia have slightly different symptom sets. They do occur in a slightly different direction depending on the dementia, and the individual will show the signs differently. It is also important that all types of dementia involve damage or loss of nerve cells and their connections in the brain. Simply put, the brain is dying. There are situations where dementia-like symptoms may occur, and I kind of referred to this previously. The fact is that the cause may be something else entirely and something very treatable. So there are vitamin deficiencies that can affect cognition and behavior that can be ameliorated through the use of food changes or supplements. Certain medications such as painkillers and many psychoactive pharmaceuticals can affect behavior very negatively. They can affect your cognitive abilities, remove the offending medications, and magically your skills come back. I only say magically because I've been through this. As I said, just adding supplements or removing the offending medications can make a huge difference. That being said, there are a number of kinds of actual dementia. You cannot stop dementia. We do not have a cure for it right now. And what we can do is slow the process and help the person function to the best of their ability. So there are things like Alzheimer's, vascular dementia, frontal temporal dementia, dementia with Lewy bodies, and of course mixed dementias. And as I said, these are not curable. You can't change them by simply removing an offending medication, but you can slow the process by doing so. Now, there's also certain diseases such as Huntington's, Parkinson's, Creutzfeldt-Jakob syndrome, and these can increase your risk of dementia quite dramatically, and they can lead to problems earlier than you would expect. So what are the risk factors? Well, there's a couple of risk factors that we simply can't control, and those are age and family history. That being said, while some people develop MCI or dementia while young, that doesn't fit with the age profile. And I need to stress that dementia is not a normal aspect of aging. We are not automatically going to develop MCI or dementia. It is not part of aging. It means there's something going on, something problematic. And as for family history, it is important, absolutely, but it is not the be all and end all. If you have a family history, and I have a very huge family history of dementia, but the reality is I also have control over my own behavior, and I can change the way I do things, or I can continue to do things in healthy ways that will reduce my risk. At the same time, there are people who have no family history who develop dementia. So what are the factors that we can control? Well, one of them is diet. You remember when Mom said to eat your greens? It's important. And diets that are rich in fruit and vegetables, fish, nuts, and seeds, as well as healthy oils such as olive oil, and low in refined sugar, LDL cholesterol, and chemicals can reduce the risk, even if you come from a high-risk background. Exercise, it really is that important. I know I stress this a lot, but I mean it. It is so important for us. Physical activity doesn't just support our physical bodies, it supports our mental health and our cognitive health. A lot of experts will tell you to aim for like 150 minutes a week of at least moderate exercise. It's important. And here's another factor we can control, and I know people don't like to hear this: obesity, through the things I just described. But weight loss does not have to hurt. I know we hear oh, it's so difficult to lose weight, you gotta starve yourself. It's not true. Don't deprive yourself, but do think about what you're putting into your body. Do think about moving a little bit more. Get up, stretch out, eat an apple instead of a candy. Just make healthier choices, and you will find that weight comes off. And here's another one we can control: alcohol consumption. High alcohol consumption has been linked to early onset dementia as well as later dementias. And limiting your alcohol consumption or getting rid of it if you do drink can make a huge difference to your risk. So if you or someone you know has an issue with alcohol, please seek help. It is never too late to stop, and you will always feel better. Those around you will feel better. It can only be good. Cardiovascular disease is another issue that we actually have some power over. So if you have a high blood pressure, a high LDL cholesterol, atherosclerosis, these conditions put you at greater risk of dementia, but they can be controlled again through diet and exercise. And in this case, it may be important to work with a healthcare provider to change your diet, to increase your exercise, and to reduce or even prevent cardiovascular disease. As we age, it is very important to keep track of things like our cholesterol levels, our LDL cholesterol levels, and how our heart health. So really maintain that. Okay, here's another one: diabetes. Diabetes 2. Diabetes 1, which is childhood diabetes. It is what it is. It's important to control it, but you can't and maintain health, but you can't stop it. Diabetes too, we do have control over. And again, exercise, diet, if necessary, medication, but do think about what you're putting in your body, what you're doing with your body. If your doctor puts you on medication for your diabetes, make sure you take it. It is important. If you don't have diabetes and don't want it, keep up that healthy eating and that healthy exercise. And here's another one we all have control over: smoking. And this is very simple. It leads to cardiovascular disease. It's associated with higher rates of MCI and dementia, and there's only one word for it: quit. It's never too late. Don't say you're too old. I hear a myriad of older people who smoke giving all kinds of excuses, but the reality is they're destroying their health and the health of those around them. Quit. Yeah, you can see I'm not big on smoking. And finally, here's another one: untreated hearing and vision loss, and I'm certainly aware of those things personally. So if you or someone you know appears to be having issues with their hearing or their sight, encourage them or yourselves to get tested. Wear your glasses and hearing aids. Learn how to use the accessibility features available with your technology. Fact is, hearing loss can be especially devastating because people, it may not immediately be apparent that they can't hear well, but they may withdraw, they may feel frustrated, they may appear confused, but in fact they're having difficulty following along. And I have been through this personally. I believe it or not, it was my sight dog that helped me to realize that I wasn't hearing things like the door being knocked on, the phone ringing. That little guy, Clifford, went out of his training and started barking loud enough that I would realize something was going on. He's the one who clued me in. But if you don't happen to have a dog like Clifford, please do get tested. If you're starting to notice things, or you're starting to notice things in others, make sure something is done. Now, like I often say, I don't like my white cane. I don't like my hearing aids, but I use them, and I use them well because they make a difference. Here's another one that I think we need to think about: mental illness. We know that late life depressive disorder has been associated with dementia, so it's very important to seek treatment. Therapy can work wonders. If necessary, medication in the short term can help to kind of turn things around. Things can be done. Depression shouldn't be left untreated. Pollution. So, for example, vehicle exhaust has been correlated with dementia. So when you're outside, consider the air you breathe, consider the kind of vehicle you're driving in, roll up your windows if there's a lot of exhaust, wear a mask, do the things that will keep you from interacting with all that pollution. Traumatic brain injury has been associated with increased risk of dementia. The more brain injuries you experience, the higher your risk. So for example, if you're not wearing a helmet in hockey, cycling, whatever, and you're not wearing appropriate gear to protect yourselves, you're kind of putting yourself at risk. So wear that headgear, wear the appropriate stuff. Sleep apnea, chronic insomnia, other sleep disorders, they all may increase your risk and shouldn't be ignored. Interestingly, the medications that are frequently prescribed for insomnia are actually known to cause dementia, so it may be worth considering holistic kinds of treatments like valerian root, or whatever works for you. And you may have to go through a few things. Set up a routine, because routine does help our bodies to know when to slow down. Don't be interacting with the internet right before you go to sleep, because guaranteed it will kind of keep your mind rolling. There's lots of things you can do to change your habits that will help you encourage healthier sleep. And if there's a risk of sleep apnea, please get it treated. Okay, I talked about low levels of vitamins before, specifically things like vitamin D, B1, B12, and folate are also known to cause dementia-like symptoms. So the best thing to do is to change your diet to include these vitamins, and if necessary, take supplements. And it will impact that. And then there are medications, and you've all heard about Benadryl. Well, most antihistamines bring some risk. So remember that many of the medications that are prescribed for many health reasons, like bladder control and so forth, they can actually cause dementia. They're correlated with dementia. So if you're on these medications, look at bringing in holistic manners of treatment and slowly reducing the medication. If, like me, you have chronic allergies, very bad hives, look at the lowest possible dose of an antihistamine and taking breaks. There's a lot of things you can do to reduce your medication dependence that will help to increase your health and reduce your risk. And also lack of mental and social stimulation. Now, you have to keep the mind active as well as the body. So things like reading, crafts, jigsaws, word puzzles, anything that keeps your mind active, anything that keeps all the centers of your brain moving. And important as well is social interaction. Now, if you're an introvert like me, you may find that less is more. You may not need as much social interaction, you may not want as much social interaction as most people think is normal. But that doesn't mean that you should have no social interaction. If you find that you are not experiencing any relationships, that you're completely isolated, do what you can. Talk to people that may be able to help you. Find ways to get out, even if it's through an online support group. That will get you involved with others. So find these methods of getting out there and interacting with others. So yes, MCI and dementia are serious. They are significant. They are not normal parts of aging. Personally, I've seen friends and family. I'm watching a friend degrade right now. I lost my mother in May. The fact is, it's just not right. Dementia hurts everybody and is awful. Watching my mother die over the years, it was like watching her die by 1,000 cuts, over and over. If we can prevent it, we should. So please do what you can to reduce your risk. And as I usually say, if you enjoyed this post, please hit subscribe and explore. Please share this site with others who you think might be interested. And remember, to be a senior is to be proud. Hugs.